I'm Dr. Heather McBryar, and I'm going to talk a little bit about what is low vision. So we all think about going to the eye doctor normally to get our pair of glasses, but when you have certain disease processes like macular degeneration or glaucoma or diabetic retinopathy, then sometimes the vision changes to the point that regular glasses aren't sufficient anymore. And that's where low vision care comes into play. So you may have an ophthalmologist or another optometrist that you see who manages your condition. Maybe you're receiving injections for macular degeneration or drops for your glaucoma. And so those are what we call things that try to maintain the vision and prevent it from progressing. But as the vision changes and becomes more impaired over time, we need different types of devices to help be able to perform activities of daily living, do things for pleasure like being able to read or watch the television, and even in some cases to be able to continue driving. So my decision to specialize more in low vision care came because I have visually impaired men in my family, and I also have a son who inherited the condition and is visually impaired. And so that makes me very passionate about what I do. And there aren't very many of us optometrists that specialize in low vision care. And so I feel really thankful to be able to do that and provide that service for the patients. One of the questions that I get asked a lot is, what exactly do you do? Because patients are sometimes unsure. They don't know that low vision even exists. And a lot of that is because there aren't many of us that do it. And if they do hear about, hey, you should go see this low vision doctor, they think, but I already have an ophthalmologist that I see, and I already have another optometrist that I used to see. And so what's different about that? And I always say the difference is we're looking at rehabilitation. So what I'm doing is saying where your vision is today, what do we need to meet your goals? And then how do we change that plan over time so that we're still able to meet those goals? So when we have patients come in, some of the things we're looking at is, how is the vision functioning? So what are you able to see on the chart? Yes, but also, are you sensitive to glare? Indoors and outdoors? Do you have difficulty with contrast? So if things are really dark black on a white background, you're able to see it, but as soon as it's newspaper print, it's hard for you to see. And so we look at devices that help with that. So sometimes that's going to be things like higher powered spectacle magnification. Sometimes that's handheld magnification, stand magnifiers, things that allow us to make the print bigger and easier to see. And sometimes we're looking at devices that allow us to change contrast. So newspaper print, we can change it from gray on gray to black on white. And so there are some digital devices that will allow us to do that. And then there are glare filters that will help with the indoor and outdoor glare. So they cut all of that glare so it's not bothersome to the patient, but then it helps to increase the contrast and make things clearer and easier to see. Most optometrists don't offer all of these things in their practice. And so the biggest question that I would encourage people to ask is, if you don't provide those services, who is it that you can refer me to? And I find that even in retina practices, doctors that know that I exist and what I do, they sometimes forget to offer that to the patient because they're busy looking at the medical management part of it. And so I always encourage patients and their family members to say, hey, what is there out there that can help me in my area, and who is it that you could refer me to? So there's a couple of state services. One of those is what are called rehab teachers. And so every state is going to have some version of that and the name that they give it. But in ours, we can connect you to the state, and every state's going to have a certain budget per individual, and they're able to help provide things. So sometimes that is providing filters or magnifiers that we recommend. Sometimes that's providing things like talking watches or larger button phones or gadgets for the kitchen like high contrasting cutting boards. They come to the homes, and they also help with things like bump dots. So if somebody's having trouble seeing their microwave buttons and they're just sort of remembering them and where they think they are, then they can place dots on there so that you know that you're punching the 3 and the 0 or the 1 minute button or whatever it is. So that's one of the state services. And another really great state service is vocational rehabilitation. And so I work very closely with Voc Rehab, and their goal is to either get people gainfully employed or keep people gainfully employed. So that service is there for people who maybe lost their job when their vision changed, but they want to go back and still work. Or maybe these are teenagers that are transitioning out of high school and are interested in pursuing higher level education or want to go into the work field. So this helps make sure that they get all of the devices and equipment that they need to either further their studies or be successful in their work environment. And then they will continue working with that individual over time to make sure that they're taken care of and covered. So a good part of a low vision exam, a large part of what I do in an initial low vision exam, is education. Education for the patient, education for their family. I find that many times they follow through with coming to see me not because they fully understand what it is that I do, but that they just hope somebody can finally help them. And so I talk a lot about what their particular condition is, how that's impacting their functional vision. It helps them understand things like, why do I see this object on the floor 1 second and then I go to reach for it and it's like it's missing, and it helps family members understand the things that they're seeing in their loved ones, because visual impairment is hard to wrap your mind around because you don't look any different. And oftentimes they're functioning well in their home environment because they're familiar with it. And so this is a really big piece of what we do initially, is talk a lot about what is it that's going on, how is it impacting you, what is that going to look like down the road, and then we start talking about patients' goals. So what are the things that they want to be able to continue doing, what have they lost the ability to do, and then we put all of that together and try to find the devices and the services that can best suit their needs to meet those goals. So I think people often don't give enough thought to what I call the grieving process. So any change, major life change like that, especially when it affects your independence, is going to come along with the grieving process. And so I always tell my patients that my goal is to give them hope and to make them realize that while the grieving process is important and it's necessary, I want to help them not stay there. I want to help them be able to progress through that. And so sometimes that is connecting them to healthcare providers who can work on support counseling and things like that to help them through that process. And sometimes all they need is hope from realizing that there is help and there are things that they can do. And I'm very open in sharing with my patients about my own journey with my son who was visually impaired. And while I didn't experience the grieving process for myself personally, I experienced it on his behalf when I realized that he had inherited the condition. And it was a difficult and long and challenging process. Grieving the fact that I knew he would never be able to drive a car and other things in life that I felt like he would miss out on. But I also feel like that's what makes me better at what I do, because I can understand on a personal and a professional level.